Senior scholar at the Johns Hopkins University Center for Health Security. Dr. Adalja, thank you for being here. From what we heard from the president, Jeremy laid out very clearly that, and we'll see, maybe the president misheard the question, I don't know, on the IHME model. But I want to ask you about the IHME model and this big shift in projected deaths, doubling by early August to 134,000, which means right now the country is only halfway there for some perspective. What is your reaction to that?
The IHME model does account for some degree of mitigation. It actually takes cell phone data, looking at mobility data of people, and uses that to update its projections. So the fact is, it's looking at what people's behavior patterns are. So it does account for what social distancing people are doing. And so in that sense, it is valid. And we all know that as you peel back social distancing restrictions, you are going to see more people interacting, and you're going to get more cases and more deaths. So that's inevitable. That's a fact. And I think then the question becomes, what is that trade-off, and how do you balance that? And that's a larger societal policy type question.
Absolutely. And you're getting at what Dr. Fauci laid out, that we played the soundbite at the top of the show, which is a stark choice that he's laying out. How many deaths, how much suffering are you, or is the country, is society willing to accept to get back to what you want as some form of normalcy? What do you make of that choice that seems to be presented right now?
It's a horrible choice to make, because this isn't something good. This isn't something that we've succeeded in doing. This has always been about trying to make sure that we got to a place where hospital capacity was preserved. And that seems to have been a problem that we've solved, although we do worry about things slipping back into hotspot status like New York City. But for many parts of the country, they never were hotspots, and their hospital capacity is okay. So now the question is, how do you decide what to do here? Because you have this economic shutdown, which eventually is leading to disruptions in other medical care: colonoscopy, cervical cancer screenings, breast cancer screenings, chemotherapy, mental health. There's a whole list of things that are getting behind, and it's going to leave a mark. And you have to try and find some middle way, because the virus isn't going anywhere. This is endemic in the human population. It's going to be a threat until we get a vaccine, and this is going to have to be people's part of their risk tolerance that they have to think about. And then in a society level, we have to think about what's an acceptable number of deaths here. And obviously nobody wants these deaths to occur, but this is a virus that's not going anywhere, and we have to try to make these decisions carefully. And there's no black or white answer here. It's all gray and no good choices. Yeah.
One other thing the president said gets to something that, honestly, you and I talk about every time you're on the show, and we're going to talk about it one more time, which is testing, the lack of testing, the need for more testing. The president said when he was at one point, he says, we have the best testing anywhere in the world, not even close. The antibody test, you see what's going on with that. That's going to be something. Look, we have so much testing. I don't think you need that kind of testing and that much testing, but some people disagree with me. What do you say to that?
Well, the whole goal has not been to test everybody a million times a day, or everybody being tested. I don't like to come up with a big number, but the point is that doctors and people have to be comfortable ordering a test and not worrying about supply chain issues, not worrying about what their hospital is going to say. And I think we're getting there in many parts. I would say over the last several weeks, it's become much more easy for me personally to order tests for people, and I haven't had much pushback from it. So I think we are getting there. But the point is, we want to be able to test for this the way we test for HIV, that we can just do this very easily, that you're not worried about anything. And that's not the case in many parts of the country, where you have governors trying to import tests from other countries. All of that kind of stuff really speaks to the fact that we have a kind of a patchwork of testing across the country. And we want to get to a point where this is just a routine test. And for example, I'm sitting in Pittsburgh, and it is becoming routine here that patients getting hospitalized are getting routinely tested without any problem. But that's not the case in other parts of the country. And for the whole country to get to a better place with this virus, that's what we really need to get. That's what we really need to go to.
And another reminder to everybody, right now, most of the states have not met the CDC benchmark of that 14-day downward trajectory in new cases. That was a benchmark set very early on, and it has not shifted. It has not changed. And so when I hear Dr. Fauci offer up a warning, which is if you open prematurely, you should expect a rebound. Should people on some level not be surprised about how really terrifying these new projections are? Because it's been out there, what should be met before you reopen, and the danger of if you do it too soon.
The models were not a surprise to me. I knew that that's what they would predict, because this is a virus, like I said, it's in the human population. It's going to spread. As long as it has an opportunity to spread, it's going to spread. And when you increase interaction between people, it's just a simple biological fact that it's going to spread from person to person. So you ideally want to be at a better place when you open it. And it doesn't necessarily have to, there's two criteria actually. Cases can be going down over a 14-day period, or the percent positive of the test if your tests are at the correct level. If they're not going down, the tests, the number of tests you're doing. So there are two gating criteria in that testing part. And some of the states are opening premature based on the gating criteria. And you have to expect that they're going to run the risk of having a second surge of cases, and hopefully it won't compromise their hospital capacity.
Yeah, and that's then the next thing you have to look at. Dr. Dodge, it's always good to have you on. Thank you.
Thank you.